Hello and welcome to this webinar about the circulatory system. So circulation as our ultimate delivery system. There are 60,000 miles of blood vessels within our body. Unbelievable though that may seem. And through these blood vessels flow the nutrients we need to function and the immune cells that defend us. And I think possibly the presence of immune cells is something that most people aren't that familiar with, aren't aware of. So this transport system also carries the waste that should be jettisoned from the body. So extremely important that this all functions well. So transport problems show up as brain fog, low energy, skin issues, wobbly blood pressure. So that could be blood pressure that's too high or too low, poor immune function, etc. Lots more issues as well. So this webinar is going to travel all around the circulatory system, checking for risk factors and fixes to keep us from flowing smoothly, everything working properly. So looking first at the arteries. So the arteries carry oxygenated blood full of nutrients, obviously oxygen, but other nutrients as well, when they're absorbed from the digestive system around the body, so feeding our tissues and our organs. The arterial walls are strong so that they can cope with the high pressure of a pulse of blood, especially near to the heart where the beat is strongest, so the aorta, which is the initial blood vessel through which blood is pumped from the heart. That leads then into the other arteries, and then the smaller arterioles into the capillaries, and then the oxygen and nutrients are able to perfuse through the walls of the capillaries into the surrounding tissues, and waste can be reabsorbed, taken into the small veins, the venules, and then the veins themselves, and back to the heart and lungs. So going back to the heart and that initial pulse of blood into the arterial system, that beat needs to be strong so that the wave of blood ripples all the way out to the furthest extremities. And then once the oxygenated blood has been delivered, the deoxygenated blood and waste that have been picked up from the cells are carried back to the heart and the lungs. And the veins that are through which the deoxygenated blood travels are much thinner than the arteries. They don't have the same structure, they don't have as much elasticated tissue, and they're thinner because the pressure shouldn't be as high by the time the blood has delivered its load and is returning to the heart and lungs with waste to offload. And this is partly because the impulse from the beat of the heart has diminished, and partly because there's no such sort of need to have that high pressure at that point. So they don't have as many layers, the veins themselves, the vein walls. And this is a very important point. We rely on muscles outside the veins to move the blood inside them. So we're not dependent on that pulse pressure from the heart. We're reliant on the movement of our muscles to push the blood along inside. So for example, flexing of the calf muscle to help propel blood from the lower extremities further up the body. And that's really important because it obviously has huge implications for lifestyles that are sedentary. So two types of vein, the deep veins that we don't see, but which actually contain the majority of the blood, and then the superficial ones that we do see more because they rise to the surface in order to allow us to release heat and improve our temperature regulation. The deep veins contain around 90% of the blood travelling back to the heart and lungs. So damage to them is more serious than damage to the superficial veins, but we see the damage to the superficial ones more easily. So those are the ones that are drawn, our attention is drawn to. And interestingly, although the arteries are what maybe gets most attention in terms of that's where we measure the pressure, they only contain around 10 to 12% of the total blood volume. And so they're a much lower percentage of our blood than we may imagine. And because it's nearer to the heartbeat, it's moving faster and more strongly, and the walls, as I've said, are more robust in order to cope with the stronger flow. So the lower pressure in the veins means that they don't get damaged by high pressure from the inside, but they are more easily damaged by issues such as overweight or pregnancy, which can put external pressure on them. Being sedentary will also put pressure on certain areas. Pooling blood in areas where the movement is too slow and there's stagnation will also cause irritation and inflammation, where the wastes in that pooled blood are sitting in one sluggish spot for a while. So there is damage done to the tissue in that area. Smoking, I feel like I shouldn't have to say this, but there do seem to still be people that don't fully realise that smoking is also damaging, because it causes constriction of veins, reduced blood flow and inflammation. And the chemicals in both cigarettes and vapes have these negative effects, and they can be very visible if you don't like broken capillaries and bulging veins. So important to draw that to people's attention if they haven't fully realised the impact of smoking either cigarettes or vapes. So veins are actually very important. We only see them when they're troubled, but they're quietly doing a fabulous job of returning blood to the heart and the lungs to keep things flowing. And that flow is vital to our existence. Without our circulatory system working properly, nothing would work. And that's why the heart is second only to the brain in terms of survival. Without blood flow providing oxygen and glucose, the brain dies very quickly. But there are some practical factors that mediate against flow. So in humans, we're not, so in other mammals, the heart is around halfway up the body. If they've got this a ratio, if you like, that it means that it's not so hard to push the blood up from the lower extremities back to the heart and the lungs. But because we are now upright, we weren't maybe originally in our evolution, but we're now upright, it is just further for the blood to travel against gravity. And the lower our overall blood pressure is and the more sedentary we are, the harder it is to push our venous blood uphill against gravity. And I find that low blood pressure is very rarely checked for. And we do see a lot of it in the clinic, people with low blood pressure that hasn't been caught, if you like, it's not been looked for. It can be associated with low iron levels, so mild anemia, and also low thyroid function. So it's always worth looking at. So just to revise this a little, we're looking at the two figures, the systolic blood pressure and the diastolic blood pressure. And anything under 120 over 75 can be problematic in terms of giving you symptoms like lightheadedness, dizziness, pins and needles, and fatigue. So really worth being aware of the problems of low blood pressure as well as high. So high blood pressure obviously is going to be potentially damaging. It can damage blood vessels and also the kidneys. And kidney damage is also a contributive factor to dysregulated blood pressure, because the kidneys keep sodium and potassium in balance, and this in turn contributes to good fluid balance. Without the kidneys releasing fluid and balancing sodium and potassium, the pressure in the arteries will increase. And the kidney hormone renin instructs blood vessels to constrict. So important that the kidneys are working well. Erythropoietin is another important kidney hormone that stimulates the production of red blood cells, which obviously then enables oxygen transport. So if your kidneys aren't happy, there are lots of implications for your circulatory system. Very simple in some ways, really, to keep your kidneys happy. Just drink some water, which I know we always bang on about, but very important. And obviously avoiding too much salt because the kidneys don't enjoy that, but also refined sugar. And that may be something that people aren't quite so aware of in terms of kidney health. In the summer, when it's really hot, we don't necessarily increase our water intake. Similarly, when our clients or our customers go abroad and they are not increasing their water intake, despite the fact that it's much, much hotter than they're used to experiencing. So they may have more alcohol or more juicy fizzy drinks, but they don't necessarily up their water intake, which is not good for the kidneys. And then in the winter, people may drink less water because it's cold and they want hot drinks. And unfortunately, this means that this dehydration means that the blood will thicken. And that's a real problem for circulation and one of the factors behind extra heart attacks and strokes, which can be seen in the winter months. So being aware of fluid intake, water intake, encouraging people to drink their water warm in the winter, for example, if that helps with compliance. Also, drinking through a straw can sometimes help people if they're very resistant to drinking water. I often recommend goldenrod and knotgrass tea for older people, elderly people who really don't like drinking water or who may be very dehydrated to the point where they're finding water unpleasant to grapple with, because if you're very dehydrated, you may become adverse to water. So just starting with some lovely goldenrod and knotgrass tea, which is very good for supporting the kidneys gently and doesn't have any contraindications with medication, that can be a good way of getting them started with a slightly better fluid balance. So as I've said, low blood pressure is not considered so much of a problem because it won't cause you to have a heart attack or a stroke, but there are unpleasant symptoms associated with low blood pressure, including a feeling of just not being very competent because your energy's poor, your memory can be poor, your focus can be poor. Also, one of the reasons that we often see tingling sensations in the skin during menopause, perimenopause, that can often be due to changes in blood pressure, and which, especially if it's low blood pressure, can reduce blood flow to the extremities, including the skin surface. So worth bearing it in mind at that time of life for that demographic as well. Okay, so looking at some fixes now. Hawthorn is a herb. Crataegus is the Latin name. Hawthorn is a herb that is very well known through herbal history as a beneficial remedy for heart function. The berries are what we use in the tincture, in the drops, and the fantastic thing about hawthorn is that it balances heart function. So it doesn't raise your blood pressure or lower your blood pressure necessarily. It just improves, feeds the heart tissue, strengthens the heartbeat, enabling the body to have a slow, strong heartbeat, which is steady heartbeat, which is what you need for good circulation. And that balancing effect is something that many herbs do have, which is very difficult to achieve with drug medication. So a really wonderful herb to have in your cabinet, your medicine cabinet. So you can look at it for angina, because again, the feeding, the strengthening of the heart tissue, moderate, high or low blood pressure. And that irregular heartbeat, we see a lot of that, tachycardia, atrial fibrillation, where you really need the heart to be stabilized and steadied. It is a very gentle herb, so it won't have swift effects, and that's what makes it safe. It's not going to be doing anything overnight. I would say 2 to 4 months of steady use before you would expect to really see any significant results, which means that it's safe to take if you're already on heart medication, blood pressure medication, because as long as the doctor's aware, because regular checking of the blood pressure will mean that the drug medication can be adjusted as the hawthorn improves the situation, which obviously is great if you can bring down the reliance on medication. And we also have we have it as drops, but we also have it maybe something to look at if someone needs to take it longer term is to take it as the capsules, which are a combination of hawthorn with garlic and some passiflora and a little vitamin E as well, which is good for the elasticity of the arteries. So hawthorn, great for strengthening that lovely, slow, strong, steady heartbeat. Then garlic with its beneficial effects on the arterial wall, similarly with vitamin E, making the arterial wall more supple. Passiflora is helping with the secondary effect of passiflora is that it helps to improve the circulation to the heart, but it's also, as you know, extremely good for stress and countering stress, which is one of the factors that we see that can affect blood pressure and have a negative effect on heart health. And then we've put a little bit of B1 in there as well, which enables us to indicate it for heart function. Another herb that I'm very fond of and use a lot of for all sorts of circulatory issues is ginkgo biloba. And this is particularly good for microcirculation, which is the circulation in those little tiny capillaries that pervade all the extremities. So whether it's right down to the fingers and the toes, into deep organ tissue, or up to the scalp and into the brain, those areas where you need the capillaries to be strong and active, able to allow the delivery of oxygen and nutrients to the tissues and removal of wastes from the tissues. So ginkgo is recognised for its beneficial action on arterial circulation, particularly microcirculation. And if you have poor flow in the microcirculation, you can see things like memory loss, tiredness, cold hands and feet, chilblains, and also, interestingly, that feeling of incompetence, that you're not really coping very well because you're not really on it. You know, your concentration, your focus isn't so good. It's horrible not being able to remember things properly. Very unnerving for people. So we like to use this alongside hawthorn if you're trying to support the entire circulatory system. Ginkgo is best for the arterial circulation, so it's supporting the blood flow through the arteries and then into that micro circulation, the little capillaries. We use horse chestnut for the venous circulation specifically. You'll find often that herbs have an affinity for particular tissue. So this is where you can position them nicely for a specific part of the circulatory system. Ginkgo can be used alongside pretty much anything except anticoagulants or blood thinners, because it does have some ability to reduce thickness of the blood, so you wouldn't use that alongside another medication for the same indication. It's suitable to be used long term. That cumulative effect that it can have, similarly to hawthorn, the cumulative effect is very beneficial. Then ginkgo can be superb like that as well. Okay, so we did some research with our ginkgo tablets. Actually, the tablets are often used in research because the authorities prefer knowing that a specific dose has been given. Obviously, you can't tell how much of that specific dose has been absorbed, but our ginkgo tablets do break down relatively easily. So although drops are better in terms of absorption, we were fairly confident that the tablets would would work. And they did in this month-long trial that was done with people between 60 and 70 years old who often do have problems with microcirculation, especially if they've been sedentary in their lifestyle. And they have these problems and the memory concentration fatigue, not being able to cope. And they found that this trial that was after 30 days, which is not really that long, you could see an improved blood flow through the capillaries, so through these tiny little blood vessels, which deliver the oxygen and the nutrients to the surrounding tissues through the circulatory flow. And they found better blood flow in the small veins as well. So because that throughput was better. And coming back to what I said before, that people may not be aware of the necessity for good circulation for getting your immune cells, your white blood cells, around the body. They also tracked those in this study and showed the improvement in the amount of number of white blood cells, immune cells in the circulatory system. So the great thing about this trial was that they were able to use very modern filming techniques. They could insert tiny little cameras. It's basically the width of a hair into specific areas of tissue and film that particular area, and then they could film it again at the end of the trial, and so they could see the difference that was made in specific areas. So for example, here's a capillary, that midsection there, that has fallen into disuse, and then you can see by the end of the trial that same capillary had opened back up, so the blood was now flowing through it. I love these pictures. I think they're really exciting to see. And again, this is tissue in the mouth, and you can see here that the improvement over the course of the trial, much stronger blood flow and more of the capillaries in use. And then you can see here that this is in a small vein, and the little white blobs that you can see that are in the tissue, that are actually sitting in the tissue rather than in the small vein there. They've moved into the tissues because the circulation is too sluggish to push them along. And then you see at the end of the trial, got lots of those white blood cells whizzing about in the veins there. And again, this is another area that they filmed in this person at the beginning of the trial. Not very many white blood cells, and by the end, lots whizzing around, doing their duty, patrolling, making sure there were no bugs that hadn't been caught. So a very exciting piece of research that. And one of the interesting things I found with the looking at what the people fed back, the participants fed back, was that there was a marked increase in their feeling that they were better able to cope, which I thought was lovely. So there are other things that ginkgo is doing as well, stabilizing the cell membranes and improving the uptake of oxygen and glucose. It's also a very good antioxidant, but it's able to relax spasm in the small arteries, which allows that perfusion right down into the extremities. And that means that it's suitable to be taken whether you have high or low blood pressure, because it's not going to push blood pressure up. It's going to relax those arteries to allow those little arteries, arterioles, to allow the blood to perfuse more fully around the body. And I love this picture. This is Alfred Vogel planting a ginkgo tree when he was 89. So we could never accuse Alfred Vogel of being sedentary. He was always on the go. Okay, so now looking at the horse chestnut, which is more specific for vein health. So when we have increased pressure in the veins will swell, the capillaries can then leak, and there will be leakage from the blood vessel into the tissue around it. So edema, fluid, and plasma being in places they shouldn't be. So the contributory factors here can be obviously a sedentary lifestyle, or even just standing a lot. So you might not be sitting, but your job, your work, whatever, might involve standing around with it, but without moving very much, being pregnant, especially if you're pregnant frequently, not having enough bioflavonoids in your diet, because those are very important for connective tissue, having a weak heartbeat, and wearing restrictive clothing, tight clothing, and then obviously in the heat as well, because that affects the function of the veins. So if there's increased pressure in the veins, then your legs are going to be tired. You can get swelling, edema. The skin may become itchy as it starts to be devitalized, affected by stagnant wastes, and it can even harden and discolor as well. We have valves within our veins which float open as a pulse of blood is pushed up the body by, for example, contraction of the calf muscle, and then they float closed again after that pulse of blood has passed through, and that stops blood from falling back down the leg, which is great. That's really good, except that it doesn't work if the veins have bulged through increased pressure, and the valves then don't meet, and the blood is going to easily pull back down in the lower parts of the body. So it's not pushed up the vein, but actually pooling lower down, and obviously all sorts of negative things happening there. And this is where you see the vein, you see the bulging vein, and that's what we call a varicose vein, so that varicosity. They can occur all over the place. You see them most obviously in the legs, but piles are basically varicose veins as well. So yeah, not particularly pleasant, and can be painful as well. And they do indicate that the tissues are becoming devitalized. So it's a very unhealthy symptom to have. And you can see here that there are many problems that are caused by that stagnation and the fluid not moving back up, or blood not moving back up the body, and then fluid leaking out and irritating the surrounding tissue. So conventional fixes, if you like, compression, which tightens the vein from the outside externally, but there are compliance issues with these, especially when it's hot. Wearing pressure stockings is not much fun, and then you've also got you can have operations where your veins can be stripped or collapsed, so that there's no longer that stagnation within that vein. However, that just puts pressure on the other veins, which then have more blood or the same amount of blood to get through fewer veins, so that increases the pressure on those remaining veins. So you will always get recurrence if that's the strategy that you've used. So you can look at increasing exercise, anything. It doesn't have to be extreme exercise. It can just be anything that improves the way that the muscles are pumping. So contracting the calf muscle, for example, is very helpful. You can also just raise the legs. So if somebody's not able to be particularly active, then making sure that the legs are raised above the level of the heart, just to give us back that benefit over gravity. So the benefit of gravity, rather. So you can lie on the floor with your legs up against the wall, or you can lie on the sofa with your feet raised on the arm of the sofa, or you can lie on your bed with your feet raised on a pillow, for example, and that all helps bring the fluid back up the body to the heart and the lungs. Cold water can also be helpful because it's toning, tightening the tissue. And then we can look at horse chestnut, which has a number of ways of working that are really helpful. So it's astringent, so it's improving muscle tone in the veins. Again, it has that affinity for venous tissue, so it's very specific for the veins, increasing the muscle tone, but through its astringency, increasing the flow of blood back to the heart. It's anti-inflammatory, and reduces, by reducing the diameter of the pores in the capillaries, it reduces their potential leakiness and therefore reduces tissue swelling, so edema in the surrounding tissues. So it has all sorts of lovely constituents that help it to achieve this, so flavonoids, and also triterpenes and coumarins, although we do monitor the amount of coumarins in our product, because otherwise it might interfere with blood thinning medication, but we do make sure that the coumarins aren't in excess in the product. So some work that was done on our Venaforce horse chestnut tablets quite a while ago now, but very obvious improvement in blood flow over 6 weeks. Again, you're not going to get a dramatic improvement in days because you're working on changing tissue structure, improving the structure of the actual tissue. So it's going to take a little while to achieve that. It's also going to be necessary to have a maintenance program, because if you stop treating veins, unless you've really changed the factors that have caused the veins to be present, the varicose veins to be present, then you're going to need to keep treating. Esculiforce, sorry, in that graphic there, Esculiforce is the Swiss name for our Venaforce tablets. There was also some research done a bit more recently, and not by us. This was a Cochrane report that looked at a number of trials with horse chestnut extract and found positive effects quite easily. And then there was another meta-analysis done in 2015, which again found that the horse chestnut extract has a significant effect, positive effect on calf spasm, leg pain, itchy skin, fatigue, but also helped with swelling in the ankle and calf. So a very unproblematic remedy to use as well, because they showed here that it was very well tolerated. They didn't have unpleasant effects with it. So we have our horse chestnut extract registered as Venaforce tablets, and we have them as gastro-resistant tablets, GR tablets, gastro-resistant, because it's quite an astringent remedy. The extract can be, if you have a sensitive stomach, it can be a little aggressive on the stomach. So we've made it gastro-resistant in the tablet, so it won't break down until it gets into the small intestine, and that makes it easier if you do have a sensitive stomach. Otherwise, you can take the drops, which obviously absorb very, very easily, and it's cheaper as well to take the drops. Suitable 18 plus, the registered remedy, because obviously you'd expect people under 18 not to have developed varicosity yet, and they're very easy to take. You can't, however, take them if you're pregnant or breastfeeding, and that's quite an important contraindication. And also if you see, bad symptoms developing from varicosity, so ulceration, bleeding, or severe pain, or if it's a diabetic that you're treating, if they start to exhibit symptoms of problems with leg or foot, then that really needs to be passed by the doctor, because it can be part of the diabetic process, a symptom of worsening of the diabetic process. So what you can use in pregnancy or breastfeeding is the gel that we make from horse chestnut. So this doesn't have a improving effect on the tissues themselves, but it just strengthens. It has a toning effect, a strengthening effect temporarily from an external topical application. So you can put that on and everything will tighten up nicely without you having to wear compression stockings. So it's easier compliance with this one. And that will give temporary relief at least, but you can use that during pregnancy and breastfeeding, and it works really quickly as well. So it's a nice way of relieving acute symptoms. It is an alcohol extract, so don't put it on the face. I say this because people do want to sometimes put it on under their eyes to tighten up eye bags. It's an alcohol extract, so it will sting if you do that. So it's not a good idea. And obviously don't get it into your eyes or up your nose. And yeah, wash your hands after use, and don't put it on broken skin or skin that's really inflamed. So overall, things that are going to help: moving around, being more active, and that can be small. It doesn't have to be, killing yourself at the gym. It can be just getting more activity, small movements into your daily life, flexing those calf muscles, being aware that they're the powerhouse that's getting blood back up from our lower extremities to the heart and the lungs. Breathing exercises can also really strengthen circulation, have a very positive effect if you're dealing with someone who isn't able to be more active. Posture as well, because if you have a cramped, slumped posture, then that's not going to help blood flow at all, especially cramping the heart. And then hydration, making sure that the blood's not thickening. Be more bat, yes, hanging upside down for a portion of the day, maybe not really very practicable, but just making sure that you're aware that if you're upright all the time, then you're always working against gravity. So spending a little bit of time with your legs elevated above the level of the heart can be helpful if you have problems in this area. And also just countering stress, because stress has a very negative effect on circulation and blood pressure. Thank you very much for listening to this webinar.